I don't know who needs to hear it, but let me tell you something about mental health profession and the diagnostics and labels that people are being given, personality disorders and all that shit. Listen, mental health profession will give you labels happily, easily, and they will give you a pill. Mental health profession will provide you with labels, identities of different kinds, depending where you are. But the truth is, mental health exists and is being sustained by people misunderstanding the whole nature of the inner world and of your psyche and your mind. Mental health profession forgot to ask a very important question. Why do we suffer as we suffer? Why? Right? So in mental health, in any diagnostic process, when the label is being issued, no one is going to take your history. No one is going to address your environment. No one is going to actually look into your eyes and listen to your story, because mental health is not random. It's a consequence, it's the outcome of your experiences. But that's been sort of pushed out of the narrative, right? So we only focus on symptoms and diagnosis and the right medication and the right treatment, but no one is asking why. Because once you start pulling apart your history and understanding that it actually makes sense for you to have anxiety, it actually makes sense for you to be depressed. Who wouldn't be? You're not a piece of plastic. You have a nervous system that responds to your experiences. You have a mind that responds to your experiences. So, before you stick another label onto yourself, before you accept another identity, because these are identities, you see, and we have a tendency as people to over-identify with some solution or some explanation or some concept, right? We like that. We like explanations. We like identifying, oh, that sounds like me, right? But if something tells you that's not the full story, ask yourself the question, why do you have anxiety? Why do you have depression? And that will alleviate a lot of your symptoms. This is not random. It doesn't happen for no reason. Nothing happens for no reason in nature, and you are part of nature. There's a process, there's a mechanism in your psyche, there's a mechanism in your mind. There are answers to why you are the way you are. You are being tricked into this narrative, very disempowering narrative. Oh, this is just how you are, and there's no other choice. And you just have to take medication for the rest of your life, or you just have to up the dose, or maybe the diagnosis is wrong. So, yeah, ask yourself why, and a lot of your understanding will become very clear, because that's the thing, like people are being kept confused about the inner experience, and that's a disservice to humanity. So start with yourself and start asking yourself the question, why am I feeling the way I'm feeling? Start digging, start being curious. Never give up on yourself.